At the beginning of that season, it looked like I wasn't going to be able to play at all. That was just hugely devastating because it was my very last season of soccer. It was a sport that I'd played my entire life. So to finish out the season on the bench, not able to even participate in practices, was just not really my vision. When I thought that was the case, that was just really awful.
When I first met Alanna, I saw her in the training room clinic at Johns Hopkins University Athletics. She came to us with a knee injury, and the injury unfortunately was affecting her ability to play soccer and also affecting her just to go about her normal daily activities like walking, going up and down the steps.
In sports medicine and PM&R, you are looking at your patients holistically, and you want to know all the different components of their health that can play an overall role in their performance and well-being. How can we address every part of their life to make them feel better overall and improve their performance at the same time?
We first started Alanna on a conservative rehab program that focused on stretching and strengthening muscles around the knee, muscles around the hip, and core musculature.
He had me working with my athletic trainer. We rested throughout that season on and off. And at the end of that season, I was still in so much pain that we took an even longer period of time off, like 2 months. And there was still pain at the end of that. So I went back to Dr. Emam to try and workshop how we could get me to play to the highest level possible for my last season of soccer.
We decided to try a minimally invasive procedure called the hydrodissection procedure. Using ultrasound, we can visualize the diseased tissue in real time, and by injecting fluid, we can try to separate the tendon from the tissue underneath and try to break down any scar tissue. By doing this, we enable the athlete to gain more mobility and more range of motion to enable them to get back to the activities that they like easier and engage in their rehab program in a more efficient way.
After the procedure, I was back in PT after about a week. And there was a ton of rehab I had to do with my athletic trainer, doing strengthening exercises to load my tendon and make it stronger. So I would say it took about 2 months after that at least to where I was really fully participating in practices, available for games.
Something that's really nice at Hopkins is how we all take a multidisciplinary approach to our patients. We're not just referring them out and letting them disappear on us. We're communicating with their therapist. That way they can give us feedback, we can give them feedback to try to come up with the most comprehensive plan for the patient.
The very first time I ran, it was just electric. And it was so exciting, and my teammates were so sweet. I had the biggest smile on my face, just kind of prancing around the field. Because it's so huge when something has been painful for so long, to have it not hurt is just unbelievable. Yeah, I remember the first game back, and I remember a coach called my name on the sideline, and I just sprinted to the sideline to do my warm-up, and everyone was patting me on the back as I was going past. Because it was just so fun. It was so fun to get to go back in the game. And I sprinted my little heart out when I got on the field. All the rehab, all the hard work of getting back to soccer was absolutely worth it, and I would do it again in a heartbeat. Just because it's the sport that I love, and it was the people that I love doing it with. So to get that last season with them was priceless.